Welcome back. Oftentimes, the elderly miss out on a lot in life because they can't hear. That's where Daniell Island Hearing Center comes into play. Here with more on how we can help improve the quality of life for our loved ones is Dr. Jennifer Essie. Good to see you, Dr. Essie.
Thank you for having me.
Now, what are some of the signs that maybe someone that's aging in your family is starting to lose hearing loss?
Well, a lot of times the person with the hearing loss will comment that others are mumbling, or I need the TV louder, or my ears are ringing. I'm sorry, you'll need to speak up because my ears are ringing so loudly I can't hear you. So some of those signs and symptoms are the early ones that kind of indicate we need to get you in for a hearing evaluation.
Well, and if folks do get into you earlier, as soon as they notice maybe a loss in hearing, is it better that way?
Earlier the better. Early intervention is key because the way the ear and the brain work, we really hear with our brain. So if we can get through the ear to the brain sooner, the brain will adapt more readily to new sounds.
Okay, and a lot of times people say, I don't want this big clunky thing sitting on my ear. How big are these hearing aids we're talking about?
Well, they're so small, and actually I have one different style of hearing aid in each ear, and in my left ear I've got a completely hidden style of hearing aid. It's called completely in the canal because virtually it hides inside the ear. It's comfortable, easy to use, and out of sight.
Definitely.
So for cosmetic purposes, this is a good choice. In my other ear, let me turn just to my right, there's a behind the ear instrument tucked just to the top and back side of my ear. And for certain types of hearing losses and the ear health that we look at, this may be more appropriate than the in the ear style. So as you can see, for short hair, no hair, very little hair, these styles work very, very easily.
Now, do they work the same way? I mean, are they pretty much the exact same device?
They're not. The computer chip and the components inside may be very similar, but the way that they acoustically bring the sound to the ear are different. And the different types of accessories we want to use, I've brought some of that today as well, may not work with the itty-bitty, teeny-weeny hearing aids.
Okay.
So we do want to encourage people to look at the bigger picture. What do we really need these hearing aids to do for you? And so lifestyle is a huge part of how we interview patients and ask, what do you need?
Sure.
What are your day-to-day activities?
The one that's actually in your canal, can you turn that up and down?
You can, and in fact, this remote control device that I have here will allow you to turn your hearing aid up or down, very, very similarly to how you'd use a TV remote, and you can change settings on your own. So if you like to go to church, if you play cards or bingo, or you're in a large room environment, you can change how your hearing aid sounds. Fabulous way to control your own settings.
Well, and in the past, for things like this, you had to go back to the doctor to get it adjusted.
You did, and so it does reduce the number of visits. We do like to follow up with you. It's really important that we know how things are going. We test regularly to make sure you're doing well, but this allows you to have some control over what you're hearing.
Now, a lot of folks always say, well, it's too expensive. I really can't afford it, and that's unfortunate.
It is unfortunate. You know, many insurance programs will not cover hearing aids, but we have found several that will. So do check with your insurance company prior to ruling out hearing aids funding on that side. We also offer 0% financing for a year, so if that helps to spread out some of the cost. And now that the technology has continued to improve, we have more features for a lower cost. So you don't have to spend top dollar to get a really valuable fine instrument.
Definitely, and when you think about it, I mean, if your hearing starts to go, it really affects your quality of life.
It does, and I know Katie from Summerbee's up next. She's going to talk about how your everyday functioning is so important. Your hearing, your vision, everything about our senses make us who we are and allow us to communicate together. So without hearing, we really lose out on that aspect.
Well, and probably the best way to find out is come in for a consultation, right?
Absolutely. We need to test your hearing. Without knowing your baseline thresholds, how you hear, we can't really make a recommendation, so we need to do that first.
Now, do you suggest a hearing test as often as maybe an eye test or as regularly as a regular physical?
Most of the time, if we do see a pattern of hearing loss emerging, annual testing is recommended. If you have more medically based hearing loss, we may send you on to an ENT, a medical specialist for monitoring, and we may monitor you more if you have cerumen wax buildup and things like that. So yes, we will make those recommendations as needed.
But no reason not to be able to hear your family and friends.
There's no reason not to. It affects everyone, not just you, and so you're really helping everyone around you by hearing well.
Well, Dr. Essie, great to see you again,
Thanks
and thanks
for
coming in.
having me. Wonderful. Thank you.
All right. Well, we're going to be back in just a few moments.